The regular foot X-ray. The regular foot X-ray. When considering a foot X-ray, you have a few options. The most common is the regular foot X-ray. This type of X-ray does not reveal soft tissue structures that other types of X-rays will. The oblique view is ideal for identifying fractures in the phalanges and interphalangeal joints. The tarsometatarsal joint and the base of the fifth metatarsal should be checked. You should also consider the calcaneum and the lateral talons. A foot X-ray is a diagnostic imaging tool that is used to look at the condition of the extremities. They are a complex area of the body, and a foot X-ray can reveal bone conditions that might require more extensive treatment. This technology is extremely effective in diagnosing a wide variety of conditions. In addition to the foot, the extremities also include the hands, wrists, hips, knees, ankles, and feet. X-rays can help diagnose common symptoms and determine the cause. They can also help find out the cause of dislocations and broken bones. An X-ray can also determine whether bones are aligned correctly and whether hardware has been properly placed. An X-ray is useful in planning surgery and assessing the results of surgery. It can detect bony growths and cysts and can help doctors determine if children are growing properly. A foot X-ray does not produce a high-quality image. The images produced by an X-ray are black and white, with soft tissues appearing lighter. This technique uses a small amount of radiation, so it's not very harmful. An ounce of radiation can harm an unborn baby, so it's vital to tell the X-ray technician if you're pregnant. Taking a child's foot X-ray can be scary, but you can prepare him or her by explaining what will happen and how he or she should behave. A foot X-ray is the most common X-ray for feet. The image is black and white, with the dense structures in the foot showing up in white. The soft tissues are darker. An atypical image will show more information than a normal image, and will likely reveal more information than you previously thought possible. It is therefore crucial to take your child's X-ray before it is due. A foot X-ray is a very safe procedure. It can help identify any injuries in the foot, and can even provide a detailed image of the underlying tissues. If you are pregnant, it is vital to mention this to the X-ray technician. If you're preparing a child for a foot X-ray, it will be easier for them to understand what to expect. A parent should explain to their child the procedures and why it's necessary. While there are no known risks associated with a foot X-ray, there is a small risk associated with exposure to radiation. X-rays may cause damage to the tissue in the foot, but radiologists will use the smallest dose of radiation necessary for the best results. Nonetheless, regular foot X-rays are not dangerous and can be very helpful in preventing injuries. Just remember to follow the instructions carefully. A foot X-ray can help diagnose many common foot symptoms. It can reveal fractured or dislocated bones. It can also help determine if a fractured bone is healing properly. An X-ray can also be useful for planning a surgery. It can detect later stage infections in the bones. The actual exposure to radiation is minimal. It may take as little as 15 minutes. If you're pregnant, be sure to tell the X-ray technician. An X-ray does not require any special preparation. However, a pregnant woman should tell the X-ray technician about her pregnancy. If she is not, she should be told that she will be exposed to radiation. Parents and children can also prepare for a foot X-ray by explaining what will happen and what it will look like. You can explain what it will look like to your child. A regular foot X-ray can be a good way to discover a strained ankle. The oblique view of the foot is an important part of a regular foot X-ray. It shows the lateral column of the foot and the third and fourth metatarsals. It is important to get an oblique X-ray to diagnose a fractured toe. In case of a fractured foot, the doctor will need to place a cast on it and tape it to prevent it from moving. Normal foot X-ray, normal foot X-ray, normal foot X-ray.